Good morning. My name is Jenny Goman and I work for CHI Mercy Health. And today we are at the fall committee meeting where we meet every 2 months to discuss specific falls throughout our facility. Usually we discuss falls that are significant or different, something that was unusual. We monitor all falls and we do metrics on all of our falls. Yet what we discuss here are things that we can do to change how we currently are managing falls. And again, like I said, those significant falls. What I'd like to talk to you today about is specifically our goals that we should have for Mercy Medical Center in decreasing falls. Right now, we have seen a decrease of 2 falls over the last 2 years, so we've been fairly stagnant in that. Last year, we had 9 serious injuries from falls, and this year we've had 2. So that is a big decrease and quite a savings, both physically to our patients, emotionally to our patients and staff, and the financial cost savings on that is very big. What we'd like to see is a decrease in all falls. So the goal for the strategic planning would be that we would decrease falls by 25% in fiscal year 18, and the stretch goal would be, because of the implementation of specific things that I'll talk about in a moment, we'll have a stretch goal of 60% decrease in our falls. So instead of having 140 some odd patients fall every year, it'd be much closer to 50 and 60 patients falling. We'd like it to be 0, but we'd first like to see a decrease because of specific things that we've done. One of the things that we are doing currently in the hospital is installing a brand new nurse call system. And there's training happening on each floor, on each nursing unit, both for the nursing staff and for other bedside healthcare workers, from physical therapy, occupational therapy, from our care management team, and many others, including even the housekeepers. They need to know how the system works and what to do. There are some specific things within, or specific technologies rather, within the nurse call system that are going to be helpful to decreasing falls. The one thing is being able to select the fact that the patient is a high fall risk patient, and a light will show up outside on the hallway, and that's something that is going to be visual to anybody who's walking by. So if you see a patient who's getting up out of bed, that would be an indicator to go in and just help to keep the patient safe for the moment until you find out what's going on with the patient. So I think that's going to be very helpful in decreasing our falls. It's also tied into the bed alarm system. Then they'll have another indication light outside of the room, and a buzzer that goes through to the call system at the desk. So both of those things are going to be significant with the nurse call system, but there has to be training involved, and that's what we're doing right now. So that's one of the first things. The second thing is that we're going to change how we do our standardized teaching across the board to all of our patients. What I'd like to see is that we have a scripting of sorts where we discuss with the patient that they are in fact a high fall risk patient, and what things we can do and what things they can do to help us keep them safe. And that portion of it just has not been standardized throughout the entire facility, and that's something that's really, really important as you go from one unit to the next, which a lot of our patients do. They don't just stay in one unit and then leave. And we want to make sure that the narrative between one individual and the next individual that's caring for you is the same, especially related to falls and what we would like to have happen so that we can help them through the process of getting out of bed and getting what they need and not feeling like they are being contained too much. One of the other things that we'd like to do is really have a standardized process on what we do when we mobilize our patients. It's yet another thing that we're not really doing well. and there's a lot of room for improvement in that. Um, Something that we're doing in our skills day this year for progressive care unit is to make sure that everybody understands why we use gait belts, how to use a gait belt, and actually how to properly lift a patient from a sitting position to a standing position. Because what we learned when I went to nursing school and what we're doing now are really two different things. The last thing that we'd like to do is to make sure that all of our nurse leaders are rounding to influence with their staff, that their staff understand the safety tools and the different things to keep our patients safe. That is extremely important. And to get our leadership to understand how to do that in a way that is open, kind, considerate, um, is an interesting task because we're all different. We're all created different, and the way we speak to each other is different. We'd like to make sure that our leadership is well versed in how to have those open conversations and how to really influence somebody to change their behavior. If they were to see somebody getting somebody out of bed and using maybe improper technique or walking them down the hall without a gait belt, how do we approach them? How do we make it a good teaching environment in those times? So I would just like to thank you for sitting through this presentation, and I hope that we're able to do what we're wanting to do, which is decrease falls and decrease the cost from falls. And I'd just like to thank you. Thank you for sitting. Thank you for watching, and have a wonderful day.